So in prostate cancer, there are multiple things going on. On the early diagnosis end, we have things such as markers to help establish whether or not prostate cancers are significant or not. We have all these different companies who give us genomic markers, and they will help us establish how aggressive a biopsy is and give us some guidance as to whether or not patients should be placed into active surveillance or treated. As we get into the area of advanced prostate cancer, what we call M1-CRPC, there are multiple new therapies that are in clinical development right now. There are drugs that are in testing for what we call the M0 space, which is the individuals who have a rising PSA after they've been on ADT and no evidence of radiographic metastatic disease. Currently, there really are no drugs approved for that space. It's thought that by late 2017 or 2018, a drug called apalutamide will be available, which will help to treat patients that are in this M0 space. There's other drugs that are also in the pipeline from Bayer, ODM, 201, and that is a similar type of a drug. It is a drug which is like enzalutamide and apalutamide, and that will be coming down the pipe, also perhaps in the M0 and M1 space. Additionally, there are all types of trials going on with things like PARP inhibitors, which are being developed and have a very, I think, bright future as far as helping us manage certain forms of prostate cancer. We'll also have assays in the not so distant future looking for what we call splice variants, VR7 variants, and these will help us establish whether or not the oral oncolytic drugs of enzalutamide and or abiraterone will be beneficial to give patients in the M1-CRP space. These assays should be out within the next year.